Now to an NBC News Daily original. The Trump administration's federal funding cuts appear to be dramatically shifting maternal health care in the global south. In partnership with the Fuller Project, a nonprofit newsroom reporting on global stories about women, we go to Sierra Leone to explore how doctors on the ground are fighting to save patients as resources dwindle.
The clock is ticking.
Baby might die.
These doctors in Sierra Leone's largest maternity hospital need to perform an emergency C-section.
The fetal heart rate of the baby is very low.
But critical supplies are nowhere to be found.
We need sutures, we need anesthetic agents to do the surgery, and those are not currently available in the hospital.
Those tools are needed to keep Sanita Camara and her baby alive, so doctors ask her relatives to leave the maternity ward in Freetown and scour local pharmacies for supplies. 2 hours later, Sanita's baby is delivered, but initially unresponsive. Both mother and son survive, yet ordeals like this have become a daily battle at hospitals all over Sierra Leone. Just over 2 decades ago, it was one of the most dangerous places in the world to give birth. An estimated 1 out of every 63 mothers would die in childbirth back in 2000. Since then, the West African nation has made huge progress, with a nearly 80% decrease in maternal deaths from 2000 to 2023. But now that progress is at risk.
It's very frustrating. You know what's supposed to be done for the patients, and there are just not things available for that.
NBC News partnered with the nonprofit newsroom Fuller Project, who spent a week in Princess Christian Maternity Hospital and saw life.
But the baby is okay. Yeah, I'm happy. I'm okay.
Scarcity.
The surgery is currently on a hold because we do not have all of the anesthetic drugs that we need.
And the fight for survival.
As a physician who has worked on the ground in Sierra Leone, how would you describe the state of healthcare there?
Today, really challenging. There have been shortages in the things that are needed for daily operations, and then when that compounds upon itself, it essentially leads to the system breaking down.
Dr. Beryl Graywood is a U.S.-based pediatrician who founded the NGO Entrust Health Solutions last year to help build capacity in Sierra Leone's hospital system.
When funding was withdrawn immediately, like it was, it created a very vulnerable situation.
When the Trump administration abruptly shut down USAID in January 2025, Sierra Leone's health ministry said it lost $45 million in funding for maternal and child health projects.
The sudden nature of these cuts is a huge blow.
It's a blow felt firsthand by families like Fatmata Kamara's. They're expecting triplets.
21, 22, we're very okay. 20 is our concern now.
Ideally, it will be on a machine, but the machine not there, so.
Her son does not survive.
Yes, I've just obtained all the documents, the cause of death of the one child, and death certificate. That was my worry yesterday.
In a statement to NBC News, the U.S. State Department in part cited its 2025 agreement with Sierra Leone that included funds for maternal and child health, saying by strengthening the health systems and workforce, countries are able to better tackle infectious diseases as well.
Is there a world where these systems can function without Western funding?
I do believe so. When you actually use aid to build and infuse sustainable systems, and then over time transition that over to the local government and local system, then you actually achieve sustainability.
As medical workers on the ground navigate this changing landscape, they maintain their resolve to keep saving lives.
They see the babies, seeing that smile on the mom's face. Very, very, very good feeling. Those feelings are what keeps us going here.
And this is not just impacting Sierra Leone. A new report from the IMF found that sub-Saharan Africa is the most aid-reliant region in the world. That report called the recent global funding cuts a shock like no other. But some of these countries are working to improve their own infrastructure. Sierra Leone's government just launched a campaign pushing for zero preventable maternal and child deaths. But the Fuller Project was unable to find specific details on how exactly that country would achieve this. So really, there remain a lot of questions about how mothers like the ones we chronicled are going to navigate this really sort of volatile landscape, Kate.
Yeah, it's really kind of stunning. Thank you for that eye-opening reporting.
Of course.
Appreciate it. We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.